Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Pulmonary embolism, we are looking at the clinical prediction and we are seeing the wells, the modified wells as well as the PERC. That stands for the pulmonary embolism to rule out criteria. Now let's look at the scoring. So first is we look at the signs and symptoms and give the score accordingly. So under the signs and symptoms, there is a clinical signs. So you have the clinical sign. So clinical sign of the DVT. So DVT clinical sign, the score is 3. Next is the diagnosis other than the pulmonary embolism is less likely. So in terms of diagnosis other than the pulmonary embolism. So other than the pulmonary embolism is less likely. Less likely. So in this case, a score of 3 is given. Next is when you consider the heart rate being greater than 100 BPM. So when the heart rate is greater than 100 BPM, the score of 1.5 is given. Next is the conditions such as immobilization. So there's immobilization greater than 3 days. So there is immobilization which is greater than 3 days, or there is surgery. The surgery is seen in the last 4 weeks. So surgery is seen in the last 4 weeks. So what is the score here? The score here is nothing but 1.5. Next is we look for the past history of DVT. So in case the patient presents with the past history of DVT and the pulmonary embolism. So in this case, a score of 1.5 is administered. Next is hemoptysis. So here in case of hemoptysis, a score of 1 is given. Then in terms of malignancy again the score of 1 is given. Now let's look at the 3-level score probability. So we look at the 3-level score probability. So here in 3-level score probability, this is the Wells criteria. That is in terms of low. What is the criteria? So there's low, moderate and high. So in terms of low, it is less than 2. In terms of moderate, it is 2 to 6, and in terms of high, it is greater than 6. Now let's move on to the 2-level score probability. So the 2-level score probability. So here we look at the modified Wells criteria. So the modified Wells criteria. So here in modified Wells criteria, it includes the pulmonary embolism, where the pulmonary embolism, this is unlikely. So the pulmonary embolism is very unlikely, and here the score is less than equal to 4, and where the pulmonary embolism is likely. So where it is likely, it is greater than 4. Then lastly we move on to the PERC. So what is PERC? The PERC stands for the pulmonary embolism rule out criteria. So it is a pulmonary embolism rule out criteria. So what is the PERC? The PERC is a quick OPD casualty tool to rule out the pulmonary embolism. So it is a quick OPD or the casualty tool. So it is a quick tool with low clinical probability. So there is a low clinical probability. So what does it contain? So it contains 8 clinical variables. So there are 8 variables, clinical variables, and if the patient meets all 8 criteria, there is no need of further investigations. So if all 8 are checked, then there is no investigations are required. So the variables are the age, which is less than 50 years. Next is the heart rate, which is less than 100 BPM. The SpO2 greater than 95%. There are no unilateral leg swelling. So there is no unilateral leg swell. There is no hemoptysis, there is no trauma, there is no hemoptysis, there is no trauma. Then there is no history of venous thromboembolism. There is no history of venous thromboembolism, as well as no use of the hormonal therapy. No use of the hormonal therapy. To learn and grow daily like this, please do subscribe.